So you have a patient that comes in, you're about to do general anesthesia on them. They're a double leg amputee, and in this instance, they're a fit double leg amputee, and so they weigh less than you would expect. How do you dose the anesthesia drugs? At the end of the day, we all dose the anesthesia drugs to one endpoint, and that's to effect. The way that you might approach this in someone who weighs less than what a traditional person would weigh is you start on the lower end of a fixed dose, or you start on the lower end of a weight-based dosing range, because all of these drugs usually have a range. They've all been tested. They gave this drug to 100 people, and each person's blood pressure was impacted by, X number with a standard deviation. So let's just start on the lower side of that, and you keep giving more drugs until you get to the effect that you want, right? So propofol, for example, traditional 1 to 2 milligrams per kilogram, but this person, let's say they weigh 50 kilograms when you would expect them to weigh, 80 with their legs, something like that. Probably start with a lower dose. But also, certain medications, you need a certain amount to get a certain effect because it's, impacting the brain. It's not really impacting the legs that are missing. Kind of depends, but the answer is always start low and titrate to effect. It's probably the safest way to approach this.